And I want to talk with you a little bit about the connection between prescription drugs and heroin, and why we're seeing heroin in our backyard. Okay, they're the same family of drugs. Opiates are opioids. You know, they are meant to do the same kinds of things. Heroin is cheaper now. You can get a bag of heroin for what, $10, $20?
You can get like 10.
And I'm sorry, I want to introduce my partner in crime here. This is Adam Riley, and Adam is the outreach worker for Hep C and HIV in our community. Heads up the outreach workers for those issues in our community right now, and he has been working on this project for probably 6 years, seeing it, and we'll talk a little bit about that. So heroin and prescription opiates are in the same drug category. Heroin is now cheaper, yes?
Right. Along with being cheaper, there's a large supply of it in Cincinnati with multiple different types of heroin.
Yes. There's a lot of different kinds of heroin. There are lots of, it's readily available. It's easier to purchase than going to a physician and going through all of the things that you have to go through with a physician to get an opiate. And use is everywhere. It is not stigmatized within portions of the community. Okay, so that's an important thing for us to know. What does it currently look like in our for overdoses in our community? Because that's one of the negative consequences from using opiates and from the move from opiates to heroin. And so currently in Ohio, there is a person dying from an unintentional overdose every 5 hours. These overdose deaths have outpaced deaths from motor vehicle accidents. That happened in 2005, and they continue to diverge. Whereas we're getting better with people not dying from car crashes, we're getting worse in terms of people dying from overdoses.
I was with Latrice Marco yesterday, who was the Youngstown County coroner. She said that right now there are more overdoses from the pills, the opiate pills, than the actual heroin. It's catching up.
Yep, it's catching up. And the pills are definitely, I mean, that's still the most prevalent way for people to be using opiates, but heroin is coming along. And heroin brings its own problems. Here's just a view of what the state looked like in 2011, with the hot spots being the worst for overdose deaths per 100,000 folks. And so I just really, we're surrounded by counties that don't have great stats with this. You notice that most of this is going on in the southern part of our region, of our state. And if I had this same kind of map for Kentucky, it would be the eastern part of Kentucky up through northern Kentucky is much more prevalent in that area. Okay, what do the regions of our state look like in terms of? Yes.
About that. Does that correspond to poverty pockets?
It does, in many ways, but not necessarily. This is not a problem of poverty. It is not. I mean, you'll get to some of that, but this is not a poverty problem. In the sense that the sellers of heroin are folks who probably live in poverty. The purchasers of heroin are not, and of opiates are not predominantly people of poverty. We'll see that.
Do you notice movement over periods of time from one space to the next?
Oh yes, as people begin to lose jobs or their addiction takes hold, they begin to lose jobs. I mean, that's common across addiction for any pills, as you any substance, as you move from using to misusing to abusing to addiction, you begin to lose assets, multiple assets that you might have, whether those are funds or family or connections or jobs. Those things go. Okay. You can tell that the blue line on here is Appalachia. So in that sense, being connected with poverty, there's definitely that connection, but it's really important to see that it's rising everywhere, that these unintentional drug overdoses are happening everywhere. Okay. There have been some legal efforts on the state side of this. Pill bill was passed, and that's closed clinics in Scioto County and other counties that were huge prescribers of these drugs. There's now Senate Bill 92, which is still in committee, but it's had some hearings that would help establish a syringe exchange program, and we'll talk about why that might be an important thing for us to do here in Hamilton County. And there are two bills that were recently introduced into the Ohio State Senate, and one is being introduced into the House that take various takes on distributing naloxone, which is an overdose reversal drug, to non-health professionals to help reverse overdoses. Now, I'm going to talk a little bit more about that as we move on and why that. So, what's our problem right here? You heard Bill say that in northern Kentucky they've had some big meetings. We've had some big meetings here in Hamilton County as well. They haven't been as well publicized as the ones over in Kentucky. We've got a task force that's working on things. So I want to ask you a question. What is the location of most overdose deaths in the metro Cincinnati area? Where do you think? Where do you think it is?
Lower Price Hill.
Lower Price Hill. Where do you think?
Warren County.
Warren County. Okay, what hospital do you think people would be going to? Would be taken
University.
to? University. Beep. Bethesda North. Bethesda North is the hospital where most overdose deaths happen or are taken. And that's what that says to those of us in the community is this happens everywhere. It's happening in the suburbs. It's happening in our rural areas. People who might come in to this hospital. This might be their closest hospital. It's happening in our urban centers, in Hamilton County, in the city of Cincinnati, the three neighborhoods that see the configuration of the most heroin arrests, the most hepatitis C, new hepatitis C cases, which come from injection use, the most overdoses. What else? What's the fourth thing? People living with HIV are Lower Price Hill, Westwood, and Over the Rhine. So those places see some of that the most. What the police tell us is that people come buy their drugs in an urban area. They drive a little ways away from wherever they have purchased, and they shoot up. They take the pills, they shoot up with the heroin, they do whatever they are going to do. And that's why some of those places may be seeing a lot of overdoses. Not because the people living there, but because of the people who stop and park in a parking lot and do this. The police in northern Kentucky see the same thing. That people get their drugs here, they stop right over the bridge for whatever reason. And there are lots of reasons why that might be.